Bartholomew Town is brought to you in part by the University of Rhode Island Online, Navigant Credit Union, the Audubon Society of Rhode Island, Newport Film, and Half Street Group.
Bartholomew Town.
Okay, a story that's been playing out here in southern New England, really, it's been heating up, if you will, over these last days. For the first time in 37 years, workers at Butler Hospital are on strike. And we're going to speak right now with a couple of people who are workers at Butler Hospital who are also in various capacities, we'll say officials with the union. So I guess the best thing to do here before we go any further is if each of you would introduce yourself so we can associate the voice and the human. We'll start with Brooke.
Hi, I'm Brooke Huminski. I'm a clinical social worker and clinician in the psychiatric emergency room at Butler Hospital, also known as Inpatient Assessment Center. I've worked at Butler for 8 years, and my involvement with the union is currently as a strike captain.
Thanks, Brooke. Niki?
I'm Niki. I'm a nurse on Riverview 2. I've been with Butler about 2.5 years. I did ICU nursing before coming here, and I'm a delegate on the bargaining committee. Okay,
so we'll get into sort of the travel of all of this right now, but just some basic calendar type of assessments here. Workers voted by over 91% to initiate an open-ended unfair labor practice strike that began on Thursday, May 15th. We have, like I said, this is the first strike in 37 years, and 60% of workers in a recent survey said that they're struggling to afford basic things like food and housing. The starting wage for a mental health worker at Butler is just over $18. So at this point, Butler has essentially said, we're going to take away your health care and benefits as a result of this strike. Where are we at right now in terms of negotiations and getting even close to a possible resolution?
I can say, just as part of the bargaining committee, and this is something that we've had trouble getting out there to the public. They gave us their last best final offer on our last day of negotiations. We gave them a counter proposal. They let us know through the mediator that they had no response to our proposals. We offered to negotiate the next day. They refused, and we've been reaching out since to return to the bargaining table, and they have refused to return to the bargaining table up to this point.
Gotcha. That's where it is right now. With that in mind, Speaker Shikarchi had put out a statement yesterday in which he writes that having access to critical, high-quality mental health services like those provided at Butler Hospital is vital to so many struggling Rhode Islanders as well as those who love them. He's calling for both management of Butler Hospital and the workers represented by SEIU 1199 New England to get back to the bargaining table to negotiate in good faith and come up with a fair deal. Patients, family, friends, and neighbors in every Rhode Island community are being impacted by the ongoing strike at Butler Hospital. My hope is that the management and the union at Butler Hospital reach a fair deal in the very near future. Right now, as it stands, Brooke, optimism that this can be resolved in due time, in short time. Where do you think this thing stands as of this morning?
I remain optimistic. I remain that there is a solution to be had. I really appreciate the support from all the delegates and all the congressmen and all the senators and all the people in the legislature, that are understanding that Butler Hospital is such an important place for this community. And all of us really want to get back to work. We miss our patients. We worry about them. We, miss doing our jobs. So I'm still hopeful that this will come to a soon negotiation table again, and we can work together with leadership to have the shared mission that serves our community.
I mentioned the wage piece. What is it that the union's looking for here that would, in the event that you are able to get back to the bargaining table, what's the ask? What if there's anything that you feel could jam this thing up even further that you just are not sensing management will budge on?
Well, they really haven't made much movement at all. The majority of our proposals, which were non-economic, they just refused to respond to. And it's not just about the pay, it was about workplace violence issues. It's about cutting our benefits. And we want to pull everybody up to, a living wage. The lowest paid members make, is it $15.30 an hour? $15.30 an hour. And, the hospital's original proposals, if you looked at how much they were willing to give with pay increases and how much they were going to cut from benefits, it actually, someone just broke it down. It was something like a 67-cent pay cut. So, so we're trying to bring everybody up to a living wage, and none of their proposals have come even close. And when it comes to pay, and for the majority of the rest of the proposals, which make Butler a safer place for patients, a safer place for staff, they just have no response to those proposals.
I want to certainly get into the patient environment and what this situation does for patients, particularly during Mental Health Month. I mean, that's really just a secondary reality, but it just coincidentally is Mental Health Month, which is perhaps some would say ironic. Brooke, you told Channel 12 that you're truly scared for your life. You rely heavily on the health insurance that you take through your job as a life-saving, as inclusive of life-saving medication. Without that medication, you'll not be alive. So this latest tactic by Care New England is essentially you're saying that this has life or death consequences.
It truly does. And that's just the reality for me. And I'm sure many other members or their families, children. The options they're giving us in terms of Cobra is quite expensive. It's almost about $1,000 at a time where we're not, making much money at all. So the idea that they would do that, which I don't know the legality of it, but the fear they instilled in us certainly isn't helping my mental health, let alone my physical health. I really, again, I rely on this specialty medication that our insurance covers that is, you have to get prior authorizations for, and it's very complicated. You can't just switch a plan and be on that medication again. Even if you go on the exchange, it's a very, again, I have a very rare disorder without going into further kind of personal details. But it is terrifying. And it's something that I thought maybe could happen, and we knew was a possibility, but I just didn't really expect management to go there, and that's been really sad and disappointing.
You obviously all are in this work for, well, you would assume someone getting into this thankless work is an empathetic person and you described caring for your patients. Looking at the macro right now and patient care, not only in the moment here during this labor action, but also in general, given the environment that you describe where wages are below the standard of living or meeting a reasonable standard of living, and also there are positions that are unfilled at Butler. What does this do in terms of the quality of care that patients are able to receive, regardless of how much your heart is in there, no matter how much your skill is on display? It seems like there may be only so much that you can do. So what is this overall situation of Butler right now, the broad pre, during, and potentially post-strike environment look like for patients?
Well, I guess I'll say that, they've brought in replacement workers that don't necessarily have the training or experience that we have. And they're making them work, I think, 20-hour shifts. And, we just know that there are patients we have long-term patients who kind of get used to counting on the staff that they see every day. And this is a big disruption for all the patients inside, but we know that they're not getting the same level of care that we deliver, especially the experienced staff who've been there for a lot of years, the people who are trained in de-escalation. And we know it's not the same with these replacement workers.
And I'll say to your other point in the emergency room, I've worked there for 8 years, all in the evenings, and I'm the longest standing evening clinician. And part of that, is we have these wonderful per diem workers, but they don't they aren't able to work at Butler because of the low pay. But they're excellent clinicians and they're excellent evaluating clinicians. So that puts an extra level of stress on, say myself, who really has been there a long time and wants it to be consistent care. But if we can't retain workers and we're kind of constantly refilling positions for various reasons, then that impacts the greater care Butler can provide. And again, like you said, an empathetic person, I'm out there doing my best every day. However, there's a breaking point, and there's a point where we all start to experience some burnout and disillusionment and sadness around, like, okay, what can we do to better provide the best patient care as a specialty hospital for Rhode Island?
What can you do to provide the best patient care for those in need right now? And what would you want management at Care New England to know is missing from the equation right now? In other words, what are your demands, not only from the standpoint of satisfying membership, but from the standpoint of satisfying the mission of caring for people who are suffering from mental health issues, crises, whatever?
Well, I think it's really hard to give the best care and really be present for the patients. When you are, deciding, do you put gas in the car or can you buy groceries? 60% of the membership recently surveyed said that they're struggling to afford housing and food. And so, the low pay is affecting people and the members. But it's not just that. It's like a retention problem. It's kind of this cycle of loss of experienced staff, understaffing, which is a regular problem. And when you're understaffed, you can't meet patient needs the way that we should be. And sometimes that leads to situations where staff get injured, get assaulted. And so it's all tied together, just the loss of the experienced staff, rapid turnover, and a lot of the staff who are there are burnt out. They're picking up double shifts multiple times a week to make up the difference. And it's hard. It's hard to do your best job to give the best patient care when you are worrying about paying for groceries.
And also, so around, we all worked through COVID, right? A lot of us there have been, I think the majority there worked through the COVID times, which were really acute and really scary. And about that time, I was really interested in what you just brought up around healthcare worker burnout, not just from COVID, but just from the what we've been dealing with. And I sat down with Mary Marin, and we started this wellness initiative to really address burnout. And that's something I've been working on with some co-leaders for the past 3 years. And we made some moves forward, but really what we know from the research in terms of addressing burnout is that people need to be paid well, people need to have good time off, people need to have health insurance, people need all these different things, feel safe at work, feel emotionally safe at work. And that we know that people who are burnt out or people that are not burnt out provide better patient care. So to your point about the larger kind of systems piece and how do we improve patient care, there is a part of that is feeding the workers with nurturance, with safety, with wages that can allow us to live in this economy in the world that we're in, and also feeling valued. I think a valued employee then passes that on to the patient they're working with. I think we all do that anyway. However, it gets harder the longer kind of those actual needs are not met.
There was a statement yesterday that came from the Providence City Council, support from Providence Council President Rachel Miller, Miguel Sanchez, Helen Anthony, other councilors as well. Inclusive in that was a note that you had been fined $500 for noise violations. What's the environment like on the picket line right now in terms of the police, in terms of management? What have you been hearing from community members as they've driven or walked by the picket lines? Do you feel like this is an effective strike, if nothing else, from the standpoint of raising awareness?
I think, we've been successful in raising awareness. I think that for the most part, the community stands with us. We have people coming down, dropping off food, gift certificates, showing support. And some of them honk the horn as they go by to show solidarity. And that's been the issue. There were a couple of members who were pulled over in their cars because they honked the horn as they went by, just in the middle of the day, not before 8 a.m. or anything like that. And so those were $500 fines each for people who are out of work right now. So that's been difficult. But
for honking their horns?
Yeah, that's what it was. It was for honking.
And this was Providence Police that pulled these vehicles over and issued those fines?
Correct.
Any other bizarre or seemingly mean-spirited situations taking place from whether it be law enforcement or anybody else out there? What are you up against as you're out picketing?
I mean, like one community member told me about like it was loud. Um, I, I understand that, and I understand that people don't want to be disrupted in their homes. And I tried to educate that person on the kind of bigger picture of this. I have another friend who lives kind of equally as close who said, it's fine. Like, it's fine. It's a little bit, I hear a little noise in the distance and otherwise I'm good. And I have a dear friend who lives really right across the street and she's made no complaints. And I told her to text me personally if she had any issues and we could negotiate and figure out a way to, make sure the community is not being negatively affected. And I've not heard anything from her. So largely positive.
All right. So we're about a week into this thing. No real clear plan forward in terms of expectations of getting to the bargaining table. Political officials or political leaders, officials have weighed in. How are you guys feeling? What's your mental health situation as a result of all of this? So what's your physical health situation? Obviously, Brooke, notwithstanding the scary description of medication availability that you just brought forth. Overall, right now, how are you and your membership doing?
I think there is a lot of anxiety there. I think most of us are very tired. There are people who are just really distressed thinking about the patients inside, how is this one doing without us? We know these replacement workers don't know the best way to care for and talk to the patients, especially the long-term patients. And so that's weighing on us pretty heavily. But the other side of it is there's so much solidarity. They'll say Butler has 800 workers, but we actually have 700 currently. We typically have about 100 vacant positions that we can't fill because of the conditions. So of those 700 on any given day, there's about 400 of us on the line throughout the day. And that solidarity along with the community support is really sustaining us.
And Brooke, same.
Yeah, I'll second that kind of dialectic, right? These like two opposing things true at once. When I go to the picket line, when I engage with members, when I do anything connected to the efforts, I feel really energized. I feel so much solidarity. I'm meeting all these new people that I don't necessarily get to see in my outside of my department. And I feel really sad, as was just mentioned about our patients, because they deserve better care. And I miss the work. I miss the ritual. I miss the connection. It's for me, it's a vocation. I think for all of us, we're passionate and that's like, we might get a little loud at times, but we're passionate about this work and we are passionate. I worry about these patients coming in because I worry about them when I'm there, so imagine not being there and not being able to kind of fulfill a vocational, feeling of wanting to show compassion and use our training and our skills that we've worked so long on and gone to school for, or just built experience over. It brings me to tears at times just thinking about, I'm going to go to work today. Oh no, I can't. And then I go, to the picket line or I do something union related. And I remember that we are in solidarity and we are supported and we are connected together. And that helps. And it's not the same as going to work and feeling that same sense of purpose and mission.
Totally understanding or totally understandable. And yeah, an uncomfortable situation at minimum. And by the way, this is just part of a broader healthcare crisis the state is facing right now on so many levels. And we talk a lot of times about, availability of providers with the Anchor Medicine closure coming on June 1st. We talk about hospital mergers and conglomerates. We talk about the performance of independent hospitals, health equity zones, and access to brick and mortar facilities in certain neighborhoods. We did learn a lot during COVID about healthcare workers and what you go through, and oftentimes what the salary is comparatively to how much sacrifice goes into that work. You know what it is? It's about priorities as a society, and it's that simple. We want to stand up healthcare. We got to stand up the people behind it. And good luck to you out there as you hopefully get back to the bargaining table and a resolution comes that is, at minimum, your membership can have a living wage to be doing the thankless work that you're doing. And thank you for being here today.
Thank you. And I just want to say for Mental Health Month that Butler serves everyone. Butler serves the whole community across socioeconomic lines, across every area in our society, every area in Rhode Island. We see college students, we see, working professionals, we see people who are unhoused. We offer so many different services, including inpatient care, partial hospital care, intensive outpatient care. Mental illness does not discriminate. And I think that's just a really important message to get out there. And thank you so much for having us. We really appreciate it.
Of course.
Hey, thanks for stopping by Bartholomew Town. For more content, follow me on Instagram @Bill Bartholomew.